Hi, and welcome to the ABCs of Senior Care. I'm Janae Mandillo, your Senior Information Specialist, and today we'll be talking about the letter I, which stands for intervention. Early intervention is one of the best things you can do to prevent crisis when caring for a senior. So today, one of the early interventions I want to talk about is medication management. Just a few moments ago, I got done talking with one of our nurses here at Bayshore Home Care, and she was giving me some success stories about interventions she was able to do to prevent and even make the lives better of several of our seniors that we take care of. So she told me that she walked into a home just a couple weeks ago, and on a dinner plate there was medication strewn about and piled up in little quadrants of the dinner plate, and that was how this patient was managing her medications. Another one of our nurses told me that she walked into a home and the patient just said, well, there's some meds in the bathroom, there's some in the kitchen, and there's some in my bedroom. And so the nurse had to gather all those up and start an early intervention there. Other times I know we've been just handed a plastic bag or a lunch bag full of medications and we had to make sense of it. So these are ways that our nurses have been able to make sense of some of the chaos going on in the homes of our patients just when it comes to medication. And when we can deal with something as simple as medications and get the seniors on the right track, it makes the rest of their care go a lot smoother. So today I'll tell you how Bayshore specifically manages the medications of some of our clients who have requested that service. And it starts here with this pill box. You can see here we've got the days of the week, and then we've got, it says morning, noon, evening, and bedtime. So this is kind of where we start. So when our nurse walks into the home and she takes an analysis of where all the meds are, she then calls the primary care doctor of our patient, and she verifies the meds that she's found in the home, and then she asks if there are any medications that we may not be aware of. She then receives the doctor's order for those medications. She'll then contact any specialists that the patient or the family members have told us about, and we will get orders for all of those medications as well. We then make an information sheet for that patient and for the family that lists the name of the medication, the dosage, and what times of day that needs to be taken. Then the nurse puts them in this pill box according to the orders that the doctor has set. And on that information sheet, she also puts a section at the bottom for medications that could be taken as needed, such as Tylenol or Advil. Now, once that's done, the nurse also assesses the capacity of the patient to be able to handle taking their medications on their own. So if they're able to set an alarm or have reminders throughout the day of maybe just a phone call to take their own medications, the nurse will leave that pill box out for them to take their medications as they need. Now, if the patient is cognitively impaired or has some dementia, we may put the medications in a lockbox in a specific place in the home, and then we will tell the family member or the caregiver. If Bayshore is caring for that patient with a home health aide, we will inform the home health aide where that lockbox is, where the key is, and then the medications are administered by one of our professionals. So once that's done, the nurse comes back weekly, and she talks about side effects. She looks for side effects in that patient. She also checks their vital signs, makes sure everything is status quo, and she'll contact the doctor if she sees, maybe there are some side effects happening, or if the changes that the medication was supposed to be making are not happening. She'll also look in that lockbox to see, are any medications moved or missed? Have they not been taking them? Based on what her assessment is, she may then recommend that we need to, maybe they're not taking their evening meds. Maybe we need to call the doctor and have those moved to bedtime or a meal time so that they're remembered more often. And then as the dementia process maybe goes on with that patient, if we need to then determine that we need to lock them, we'll do that at that time. But that's why it's so important to have the nurse come in weekly so she can see if there's any decline in the patient, or if there's any medical issues that maybe are to blame because the medications weren't being taken properly. So it's a great service to have on a weekly basis, and that is all done by our registered nurse or our licensed practical nurse here at Bayshore. I hope that's helpful, and if you're interested in medication management or any of our home health aid services, you can call Bayshore or visit us online. Thanks so much for clicking here today, and we'll talk to you soon. Bye-bye.